Breathing. Something most of us never think about. But for millions of people living with chronic lung diseases, every breath can feel like a struggle. Simple tasks like walking to the mailbox or climbing stairs can seem impossible. But what if there was a way to regain strength, control, and confidence? That's exactly what pulmonary rehabilitation is designed to do. It's not just exercise, it's a life-changing, science-based program that helps people breathe better, feel stronger, and live fuller lives. Pulmonary rehabilitation, often called pulmonary rehab, is a structured program created for people with chronic respiratory conditions, such as COPD, asthma, pulmonary fibrosis, cystic fibrosis, or after lung surgery or transplantation. It combines physical training, education, and physiological support to help patients overcome the limitations caused by breathlessness. Unlike medications, pulmonary rehab doesn't directly improve lung function, but it helps your body use more oxygen more efficiently, and it improves the way you live with your condition. Pulmonary rehab is especially effective for people with moderate to severe COPD, but it's also beneficial for patients with asthma or interstitial lung disease. It's even used before and after lung surgery, to prepare the body for the stress of surgery and to recover faster afterwards. If you often feel breathless despite treatment, or if your daily activities are becoming harder, pulmonary rehab could make a significant difference. Exercise training is the heart of pulmonary rehab. Under the guidance of respiratory physiotherapists, patients train several times a week. Walking, cycling, stretching, swimming, or doing resistance exercises. The goal: to strengthen your muscles, improve stamina, and teach your body to work more efficiently with limited oxygen. When muscles become stronger, they demand less oxygen for the same activity. That means you can do more with less breathlessness. Even small improvements in endurance translate into major gains in independence and quality of lives. But pulmonary rehab isn't only about physical training. Education also plays a major role. Patients learn how to use inhalers correctly, recognize early signs of exacerbations, and take action before things get worse. They receive guidance on nutrition, energy conservation, sleep hygiene, and how to cope with flare-ups. In short, knowledge replaces fear. Understanding your condition empowers you to manage it instead of letting it control you. Living with chronic breathlessness can be emotionally exhausting. It often leads to anxiety, depression, and social isolation. And that's why pulmonary rehab includes physiological and social support. Patients learn breathing control techniques like pursed lip breathing and relaxation exercises, and participate in group sessions with others facing the same challenges. The sense of community helps rebuild confidence and breaks the feeling of being alone. Pulmonary rehabilitation is a team effort. Each patient is supported by a multidisciplinary team: a pulmonologist to assess medical needs, physiotherapists for exercise and movements, nurses for monitoring and education, dietitians for nutrition guidance, and physiologists or counselors for emotional support. Together, they build a personalized plan that fits each patient's abilities, goals, and challenges. The results are impressive. Research shows pulmonary rehabilitation can reduce hospital admissions and emergency visits. It improves exercise capacity and daily functioning, decreases symptoms of anxiety and depression, and enhances overall quality of life. Even patients with advanced lung disease experience meaningful improvements, not because their lungs are healing, but because their body is adapting. Pulmonary rehabilitation doesn't cure lung disease, but it helps people live beyond it. It teaches you to breathe better, move better, and feel better. If you or someone you know is struggling with chronic breathlessness, ask your doctor or healthcare provider about pulmonary rehab. It could be the first step towards reclaiming your breath and your life.